Once you have developed treatment goals along with your client, it's important that you evaluate the client's progress toward their goal, but also the process of therapy as well. So during the course of treatment, you'll want to engage in treatment monitoring. This is tracking the client's progress toward their goals. But you'll also want to utilize process evaluation. This is an ongoing assessment of aspects of care like the therapeutic relationship, the client reaction to treatment, and client status. So with treatment monitoring, you're measuring the client's progress toward changing the behavior they have identified. But with the process evaluation, you're evaluating the actual therapeutic process. How do they feel in the sessions with you? How is your therapeutic relationship? And what are their reactions to what's happening in therapy? So here you're evaluating the process as opposed to the outcome. So you'll want to assess the frequency, duration, and intensity of the target behaviors. And you can use several different methods of measurement to do this. You can use standardized measures. So for example, outcome questionnaires or outcome rating scales. So let's say that your client's goal is to um, reduce their rating of depression on the Beck Depression Inventory. So that's a standardized measure that you can use to assess your client's progress toward their goal of reducing their depression. You can also utilize client self-reports or self-monitoring so your client can report for themselves how they're progressing toward the goal. So on a scale of 1 to 10, how would you rate your depression? When you came in, you rated yourself an 8. What is your current self rating of your depression? Or you can use self-monitoring, things like journals. So they may record um, the number of times that they uh, have suicidal thoughts a day. So you can have them monitor that and bring in that rating of their suicidal thoughts. Or they can measure, pain episodes. Every time you have a pain episode, rate your level of pain, and let's see if we're able to over time reduce the amount of chronic pain that you're experiencing. So there your client is rating themselves or monitoring their own behavior. You can collect data from collateral contacts. So these will be things like friends and family. Of course, you'd have to get permission from the client to do this, but that can be an important source of information about your client's progress toward their goal. And you can collect data with the client's permission from other professionals like teachers, school counselors. Of course, this is very relevant for child clients. So ratings from teachers, from other school staff, from parents can also be a good source of information. So when do you want to evaluate the process and outcome? Of course, at the start of therapy, you want to get a baseline measurement. Then you want to have several measurements throughout treatment. So during the treatment process, again, measuring your client's progress toward their goal and also their experience of the process of therapy. You want to have a post-treatment measurement. So at the conclusion of treatment, you're going to measure your client's status in progressing toward their goal. And then you want to have follow-up measurements. So maybe you're following up with your clients 1 month after concluding therapy, 6 months after concluding therapy, and 1 year after concluding therapy. So you want to make sure that those positive behavior changes have been sustained over time.